Despite efforts in diet and exercise, some people face challenges reaching their goal weight. Strategies like medical weight loss programs or surgical options could be beneficial. And joining us to discuss those options is Dr. Paul Kemmeter from University of Michigan Health West. Good morning, Doctor.
Good morning.
Thank you for being here. What alternatives when it comes to a weight loss? Obviously, this time of year, people are thinking about that.
Sure.
What are the options?
Yeah, I think, before you get into the options, I think there's a misnomer of what obesity is. So obesity is it's not about weight, and I know that's weird. Obesity is actually where we store too many calories in the form of fat. And so when we're treating obesity, it's kind of, people always think it's calories in, calories out. That's where dieting comes from, right?
Sure.
All you got to do is eat less and then you'll lose weight. And that's true, you actually will lose weight. The problem is there's a bunch of mechanisms inside of us that are saying, hey, you've got a set point, you need to stay here. And you can lose weight within a range, but ultimately, if you ever give up on the diet or if you give up on the extra exercise, because you've driven your metabolism so low, you just gain that weight back really fast. So you've heard of yo-yo dieting, and that's the norm, right? So most people, when they're losing weight, they're actually yo-yo dieting most of their lives. And that's because of that set point that's there. If you're going to try to treat the disease of obesity, you actually have to have a multimodality approach to it. So diet and exercise is the hallmark. You have to have proper nutrition and exercise to be healthy. But then, fortunately, we have now these things called anti-obesity medications, and they're very, very popular.
Yeah.
They do help people lose more weight. The issue with it, of course, is you have to stay on them.
Absolutely. Yeah. You just talked about a comprehensive approach. We're not just talking diet and exercise, much more to it. Is there any type of genetic component or cultural component, emotional component?
Absolutely. If you look at when people usually will gain weight, and especially for women, it tends to be about the time that they start having their periods. It's about the time when they'll have babies, and it's about the time when they go into menopause. And so that highlights how there are a lot of these hormones that are involved with it. And of course, those hormones are controlled genetically. Clearly, there's environmental portions of it as well, so environmental and behavioral pieces that play a role into it.
Now, for those who have done that diet and exercise, and they're still struggling to meet the goal, and they've done many other things, surgery could be beneficial. Can you talk about bariatric surgery?
Yeah, absolutely. So when we talk about diet and exercise, again, it doesn't address that set point. When we talk about anti-obesity medications, it doesn't address the set point. It widens the range where we can lose more weight with it. The only one that does address the set point is metabolic surgery, or bariatric surgery, as you called it. And there's a number of different techniques. We have the sleeve gastrectomy and the gastric bypass and a duodenal switch. There's a lot of different techniques that are there. But I think the main thing is that, as you mentioned, having a comprehensive program. We're entering into the time of the year. January 1's right around the corner. People are like, hey, I'm gonna spend a lot of money going to a commercial program, and all they talk about is reducing calories. Mm-hmm. Really, what people need to do is focus on the whole program. And for some people, diet and exercise alone is going to work, but for some people, you're going to need to have an anti-obesity medication, and for some people, you're really going to benefit from having metabolic surgery.
Well, let's talk about both of those. First, let's stick with the surgery. How would one qualify for that?
Yeah, so when you use the word qualify, there's the patients who qualify because of what we decide as bariatric surgeons would be qualified, and then there's those that their insurance says, hey, you qualify for surgery. Okay. So what I'm going to tell you about is what we as a society say, the Bariatric Society, and that is if people have a certain BMI. Right now we're using a BMI between 30 to 35 if they have diabetes, okay. But if it's 35 and above with other comorbidities like high blood pressure, diabetes works there, sleep apnea, and then if their BMI is over 40, and BMI is basically just, we take their weight and divide it by their height and come up with that number.
Yeah, the body mass index.
That's correct.
Right? Absolutely. Yeah. So now the drug that we're talking about, Ozempic. I mean, I see commercials for that.
Yeah, Ozempic is really designed for, or it's approved for diabetes control. The one that's really the more related to losing weight is Wegovy.
Wegovy.
Yeah.
Okay.
And so Wegovy is called a GLP-1 agonist, and it really works to help people lose weight because it slows their intestinal tract down.
Oh, that's how it works. Okay, so obviously, once you've started this process, a key would be to have support Because, boy, you don't want to fall off the wagon, right? And you offer that ongoing support.
Absolutely. That is probably the key to long-term success. So I would say what makes our program the most unique is that we spend a lot of time educating. Because if people understand everything that we're talking about, they're more apt to follow through what we recommend to them. And that's what's really nice about this program is we can get the educational piece to start that piece today.
Knowledge is power. It is part of that process. Weight management. You can get a good grasp on it and get more information by visiting the website, uofmhealthwest.org, or call that number on your screen if you have any questions, 616-252-7338. Doctor, thank you so much for the time.
Yeah, thank you for having me.
Appreciate it. We'll be right back.